Hello, my name is Mansoor Shafkat. I am the Senior Global Health Officer for World Health Organization, and I would like to welcome all the representatives from different organizations to this presentation, where we will look at the practice of open defecation in different regions of the world and how this practice gives rise to various diseases. In particular, we will look at a couple of different data sets which deals with mortality of children under the age of 5 due to diarrhea in regions where practice of open defecation is still a large public health issue. Consider this fact, that countries where open defecation is mostly widespread has the highest number of deaths for children under age 5. As well as the highest level of malnutrition and poverty, and big disparities of wealth. The practice of open defecation is a large public health issue, and it has adverse effect on public, global, and environmental health, and it is practiced by more than 1 billion people worldwide. This accounts for about 15% of the global population. The practice of open defecation leads to transmission of various diseases. These include cholera, diarrhea, hepatitis A, typhoid, and polio. In sub-Saharan Africa, diarrhea is the third largest killer of children under the age of 5 years old. Lack of proper sanitation causes 280,000 deaths due to diarrheal diseases worldwide and contributes to malnutrition. Better sanitation and hygiene overall could prevent the deaths of 361,000 children aged under 5 years each year. Here are a couple of pictures where you can see people using bodies of water which are contaminated, has a lot of waste products, and possibly defecation has taken place around these areas by looking at these pictures. And you also see animals in the very first picture that are drinking out of these water as well. So overall, this is a very dark picture. Now, before we get into the data set, in 2015, 2.3 billion people lacked basic sanitation services, and among them, almost 1 billion people were practicing open defecation. If sanitation services can be improved in these regions, not only does it lower the risk of various diseases and malnutrition, but it also promotes higher literacy rates by promoting school attendance for girls who would avoid going to schools due to lack of bathrooms and having access to basic sanitational needs. So by providing a proper toilet, a proper sanitation area, we're actually helping these children to attend school, and in return, the country's literacy rate will rise as well. So, it's very important to have these facilities in these regions so people can start sending their children to the school. Now, in this data set, we're looking at the percentage of population that are practicing open defecation. This data was collected by the United Nations Children's Fund, UNICEF, which is an organization that works in 190 countries and territories to help reduce the rate of child mortality across the globe. The UNICEF has had effort for collecting various data sets like the one that you are seeing here by getting community feedback and household surveys. So let's look at this data here. If we look at the region of Latin America and Caribbean, about 3% of population is practicing open defecation. We look at Western Asia and Northern Africa, about 4%. Eastern and Southeastern Asia, 3% of the population practicing open defecation. Australia and New Zealand, 0%. Look at Northern America and Europe, 0% of open defecation. However, when we focus our attention to Sub-Saharan Africa and Oceania, Central and Southern Asia, we have 23% people practicing open defecation in Sub-Saharan Africa, 12% in Oceania, and 30% of the population living in Central and Southern Asia practicing open defecation. These are some large numbers. There's a lot of work that needs to be done. In this data that you see here, this was also pulled by UNICEF, which, does large numbers of projects in these countries that needs a lot of help in order to improve the living situation there. The organization hopes by collecting data, which is comprehensive and up-to-date, it aims to successfully link it and other evidence for advocacy, establish a level of presence in these countries, and form a strong relationship with their government partners to help United Nations and other organizations to better target emergency support as needed throughout these regions across the globe. So I looked at Kenya, which is a country in Africa, and India, which is a country in Southern Asia. These are two countries that has a large number of people practicing open defecation. Then I looked at the number of children that under age 5 die in these countries due to diarrheal diseases. Let's look at Kenya. In 2000, 14,000 children, over 14,000 children died of diarrheal diseases that were under the age of 5. In 2005, almost close to 11,000 children died due to diarrheal diseases in Kenya. Now, the number is decreasing. In 2010, it's about 7,700 children that died. And then in 2015, a little over 5,000 children died due to diarrheal diseases. So this is great news. The number is overall decreasing, but this is still a very large number of children under age 5 in this country that are dying due to diarrheal diseases because the practice of open defecation is also on a large scale in this country. Looking at India, a country that has a huge population. In 2000, 339,000, almost 340,000 children died due to diarrheal diseases that were under the age of 5. In 2005, about 244,000. In 2010, 164,000 children died due to diarrheal diseases. Same trend. The number, if you go around the pie graph, is decreasing, which is great news. It's great news. However, still a large number of children are dying due to diarrheal diseases. In 2015, 110,000 children, over 110,000 children died due to diarrheal diseases in India. So there's still a lot of work that needs to be done. Here is a infographic that talks about open defecation and diarrheal diseases. The key fact for us to remember here is that 2.3 billion people worldwide still do not have access to basic sanitation facilities such as a toilet. Almost 892 million, close to 1 billion people are defecating in the open, for example, in street gutters, behind the bushes, or in open bodies of water. And then these bodies of water are being used for bathing, cooking, etc. The health issue here that is into play is fecal contamination. Fecal contamination leads to risk of diarrheal diseases, intestinal worm infections, malnutrition. And the effect on children under the age of 5 is huge. 361,000 children under 5 years of age die each year due to diarrheal diseases. Just alone in Kenya, over 17,000 children under the age of 5 died due to the lack of proper sanitation. Now, if we look at environmental effect, 90% of sewage goes directly into lakes, rivers, and oceans in developing countries where the rates of open defecation are higher. So it's contaminating the environment as well. Awareness is a must. International health organizations such as World Health Organization and UNICEF hope to partner with local communities in these countries that have high rates of open defecation to lower the mortality rates of children due to diarrheal diseases. So there's a direct link between high rates of open defecation leading to diarrheal diseases, leading to a large number of children under the age of 5 dying. Here we are looking at an influence diagram to visualize the relationship between our stakeholders here with one another and with the target population. Our target population being children under the age of 5 suffering from diarrheal diseases, and the stakeholders include local community of the region, parents and families with children, health educators, Department of Education in these countries, health organizations such as UNICEF, World Health Organization, media personnel as a stakeholder, Department of Municipality and Environment. We have Housing and Planning Department. regional departments of health. And we look at the connection or relationship between these stakeholders, there is definitely a relationship. For example, look at Housing and Planning Department, has a direct link. These are the folks that will need to look at developing toilets for these houses that are being made in these countries, in these regions where practice of open defecation is very high. Department of Municipality and Environment, communication, important between them and the regional Department of Health. Feedback to see how things are going. We look at media personnel, very important people in raising awareness for open defecation, obtaining feedback and airing health campaigns against open defecation, how open defecation is leading to children dying. So media personnel is very important. They have direct relationship between people with Housing and Planning Department. People of Housing and Planning Department can work with media personnel to get the word out there that toilets are needed in these houses. We look at parents and families with children under the age of 5. They're directly linked. Children that are living in these families need to have better services so they can go to school, they can live a healthy lifestyle. We look at Department of Education, have a direct link with health educators. They're employing a lot of these health educators, and the health educators are working in these local hospitals and health clinics. So they're sharing data. The hospitals and health clinics are providing medical support to these children. And we look at the hospitals and health clinics sharing information once again between them and the regional departments of health. The regional departments of health are getting these feedback or communication from families, and then they're transporting that to the larger Department of Health for that country, for the public health department. Also, same thing when we look at funding. Health organizations such as UNICEF, are providing funding to departments of education. So there's definitely a lot of links and relationship between the stakeholders with one another and with the target population of children under the age of 5 dying from diarrheal diseases. Let's look at how can we take all this information and provide dissemination of recommendations in order to improve the overall condition. The key here is raising awareness. Raising further awareness to the rural areas of developing countries regarding general health. Communities need to be made aware of the potential diseases that are out there because of open defecation and other risks that are associated with open defecation. People need to understand the worth of investing in toilets in terms of health benefits. The best way to encourage people is by educating them, telling them why it's so important, working with international organizations and partnering with various public health departments of the country, holding an open communication dialogue within communities most affected. I made up a hashtag, end open defecation, could be totally used in social media campaigns. Why it's so important. Making a case to the national government of the countries with high rates of open defecation. The best way to encourage governments is when larger population demands a change. And if sanitation becomes a priority for donors, developmental banks, non-governmental organizations, NGOs, it will have a direct impact on the governmental policies in reference to sanitation improvement required in the country. So, ending open defecation will lead to the number of deaths going down for children that are under the age of 5 and overall improving the conditions for these children and these families living in these countries where the practice of open defecation is on the rise. So we want to make sure we bring that down, which, will definitely help in lowering the number of diseases and in lowering the number of deaths. Thank you for your time. Thank you for listening. Here is a page of references if you need further information. And I hope this has been very helpful. Thank you for listening.